Hello, my name is Bethany Samuelson-Bano. I am the Deputy Editor of ASH Clinical News, and we are joining you here live from sunny Orlando for live coverage of ASH 2025. There's some really exciting science, specifically in hemoglobinopathies, and I'm delighted to welcome Dr. Calhoun from Yale University here to talk to us about some of these updates. Thank you for joining us, Dr. Calhoun.
Thank you for having me.
We love having you. This abstract that I want to talk about, talking about the link between health-related stigma and perceived discrimination in patients with sickle cell disease. And can you talk a little bit about your experience with patients? And, obviously the stigma is real. It's not just perceived, but the person's perception and experience of it obviously impacts their health.
Absolutely.
And so would love to hear your thoughts and experiences around that.
Absolutely. So we know that people with sickle cell disease experience a lot of stigma and discrimination that leads to suboptimal outcomes. We've really worked as a community of hematologists and sickle cell providers to put processes in place to improve these things, like individualized pain plans and education. But ultimately, it continues to be a pervasive issue that affects care.
Yeah.
So it's pretty awful.
Yeah.
And certainly our patients just in a one-on-one setting often tell us in the emergency department their experiences or the lack of knowledge amongst even doctors about how to care for people with sickle cell disease is something that deeply impacts them. Yeah.
And some of the quotes were really heartbreaking to me. People saying they feel like other people feel like they're better than them, or they're really careful about who they disclose their disease to. How does that line up with your experience? And have you have any thoughts about how we can make patients more comfortable in one-on-one interactions?
Yeah, absolutely. So it definitely lines up. There's a lot of qualitative work, especially as we think about our adolescents and young adults around this feeling of isolation and how that affects how they experience their disease and lack of community. Even in my own practice, I always like to ask my young adults when I first meet them, what kind of sickle cell disease you have, and then so they know their genotype. And I'll ask them, when you tell your friends you have sickle cell, how do you explain it? And a lot of times they say, I don't.
Wow.
Part of that is wanting to fit in, but part of that is just the stigma of having a chronic illness, and the stigma of sickle cell disease, not wanting that to be imposed upon them. And so I think when we think about solutions or what's in our power as providers to do, we have a lot of power. I think there are many, many things we can do. I think there's one, accountability amongst our colleagues, on which I think we are becoming better at. We're deeply committed as hematologists, but how do we spread that kind of energy and responsibility to maybe our ED physicians who care for our patients a lot, or other physicians who may not be in academic centers or be as familiar with sickle cell? How do we, empower them with knowledge to move from a place that's less biased, right? Because we all have biases. I also think we can think about how we leverage care delivery in our health systems and processes. These are things like our individualized pain plans or care pathways that allow us to maintain a standard of care, thinking about systems level things that we can do to improve care. But ultimately, all the work that we need to do needs to involve and center the patient.
Yes.
So really hearing from them about what's important and how they think we should tackle these things and what would be best for them, I think would be something that's absolutely essential to combating this.
I love that. And then the bleeding disorder space, we often refer to patients as lived experience experts, because they're the experts on what it's like living with these diseases.
Absolutely. Yeah, I guess one thing I would add too is just bringing awareness to the community, like supporting our patients. Sometimes our patients will say, my employer doesn't understand how sickle cell affects me, or they don't know what it is, or our students who are in school, maybe their teachers have never heard of it, but we are in a position as hematologists who are fellowship trained, who have lots of knowledge, who know how to deliver this information, to do that for the community as well. So,
that's awesome.
Yeah.
And where do you think the next steps are in terms of research? Because it's nice to see these data really confirming what we experience in
Yes,
care,
absolutely.
and to be able to kind of translate that to all the parties that you talked about. So
Yeah.
where do you see us going next in terms of research?
I mean, we know that there's some association between health-related stigma and pain. I think we can think about that in other outcomes related to sickle cell and further develop that pain literature as well. And I also think that we can start to think about the interventions to mitigate that and how they impact outcomes. And so I really hope that people who were able to read the abstract, see the abstract, who are even listening to this video, feel empowered to come be a part of that work, because it will be collective.
Yes,
So,
I love that. We all have a role to play.
yeah, absolutely. Yeah.
Well, thank you so much for your time and your insight. This is super helpful.
Pleasure. Thanks for having
Really
me.
enjoy it. And thank you for joining us. And as a reminder, you can get more of our ASH 2025 live coverage on the website, and there will also be lots more to come in our January issue of ASH Clinical News. Thanks for joining us.